Hi guys, we're back at Aesthetica today with Dr. Enrico to talk about all things rhinoplasty. So Dr. Enrico, tell us a little bit more about yourself.
I'm a plastic surgeon from Bergamo, Italy, close to Milano. I've been working in reconstructive surgery many years and plastic aesthetic surgery as well in a major state hospital in my country. And in the last few years, I've developed an interest exclusively for rhinoplasty. Rhinoplasty is all I do. I'll be the next president of the European Society of Rhinoplasty, and I've been president of the Italian Society of Plastic Surgery, but this is just not influential.
So Dr. Enrico, let's talk about rhinoplasty. What is a primary rhinoplasty?
So a primary rhinoplasty, the term primary in a way says it, is doing a rhinoplasty changing the form, the shape and function of the nose on a patient, male or female, who has not had surgery before.
So what matters in a primary rhinoplasty?
The things that matter in primary rhinoplasty are essentially two. One is understanding clearly what the patient desires and seeing whether that's technically possible. A simulation is so essential for that. And the other thing is doing it right, doing it well, which takes time and care. And that's why modern rhinoplasty is so sophisticated, the results are so good, but expertise and due time are so important. Techniques have changed considerably.
And let's talk about a secondary rhinoplasty. What is a secondary rhinoplasty and what does it involve?
Secondary means done already once, although it can be tertiary, quaternary, it depends. I do people operated 10 times before. So it's more complex. It requires a level of expertise which is a higher one, and you often need to dismantle some things, cartilages and bones and soft tissue, and rebuild them. So regarding a primary rhinoplasty, that will take me 3 hours, a primary rhinoplasty. A secondary rhinoplasty may take 5, and often require the use of rib grafting, which is taken by a small incision at the fold below the breast.
Okay. And how important is function during a rhinoplasty?
Function is so important that I'm still bewildered how many times it's not considered. If a nose breathes well, after surgery, it should breathe equally well. If a nose doesn't breathe well, then you have to fix both. In either case, during surgery, the septum and functional issues, turbinates and other things have to be considered. That's why you cannot separate the functional aspect from the aesthetic aspect. They work in coordination.
So what about the operation itself, or the procedure? How long does it take? What about the anesthesia? Is it open or closed?
I only do open rhinoplasty. Open rhinoplasty is very sophisticated and it can get direct viewing of what you want to achieve. So I do it for one reason, which is essentially being able to see and control what I'm doing. Now that doesn't mean that a closed rhinoplasty is a wrong procedure. I just feel after many years of dealing with these issues that an open rhinoplasty will satisfy me more and get better results.
What about the recovery and downtime? Can you tell us a little bit more about that?
Although it does take longer time than most people expect, again, a primary will last about 3 hours, a secondary will last 5 hours, the downtime is essentially surprisingly good, meaning that you do get swelling, yes, but you get some swelling limited to the nose region. You don't get bruises, you don't get swelling to the face. So those instances in which you got these big hematomas and ecchymosis, after a 30 minutes operation, which lasted little, but the swelling and the ecchymosis lasted so long, that's gone, that's past. Techniques are changed, so you get some swelling limited to the nose, and that will dilute itself progressively over a few months. Essentially, you will have something on top of your nose, like a splint and other things, for 1 week, together with something inside your nose, which is silicone splints. The following week just tapes on top of your nose, and after 2 weeks essentially nothing. Although I have to say this surgery has to be done under general anesthesia, and the reason is you want patient safety first, and patient safety means control of the airways and control of the blood pressure.
So I hope you guys got all the information regarding rhinoplasty. If you'd like to book an appointment with Dr. Enrico, or if you have any more questions, please contact your closest Aesthetica branch.